Mr. Speaker, helping those on low incomes is not a strength of this government.
No.
Today, Graham Lane, speaking about Manitoba Hydro, emphasised that the NDP government's approach is putting at greatest risk those on low incomes.
Right.
Also today, a report by the Manitoba Centre for Health Policy shows that this government does least well when addressing the issues of those on low incomes, with high school graduation rates being extraordinarily low, 19% in Point Douglas and less than 50% for all Manitoba for those in social housing. I asked the Minister of Education, what specific measures will she initiate this week to improve the extraordinarily low high school graduation rates for children in social housing?
Member's time has expired.
Mr. Speaker, high school graduation has increased. High school graduation has increased in Manitoba. High school graduation has increased in Manitoba from 73 to over 83%, Mr. Speaker. That's a very significant improvement from the days when the members opposite used to boot people out of school when they didn't like their behavior. We find ways to engage young people and continue in high school. This was the government to change the requirement for high school graduation for staying in school from 16 to 18. We have very targeted special incentives to go to various high schools around Manitoba that encourage programs that will retain more people in high school and help them graduate. And now our high schools are building shops that will allow young people to get into the trades while they're in high school and be able to get a good paying job as they graduate, Mr. Speaker.
Mr. Speaker, high school graduations are extraordinarily low for those in social housing. One of the reasons for low high school graduation rates is that children with speech and language disorders remain undetected and untreated. 1 in 6 Manitoba children have a communications disorder, yet this government has only 1 speech-language pathologist for every 4 to 6 schools. In North Dakota, for example, they have at least 1 for every school. Central to solving the communications problems of children with low graduation rates is the fact that there needs to be a university-based training program for communications disorders in this province. I asked the Premier, when will he initiate such a university training program in communication?
Order, please.
I do thank the member for the question. He has correctly pointed out that there are things that we can do to expand training for healthcare professionals as well as education professionals in Manitoba, which is why I was very pleased to recently be at the School of Nursing, where we've expanded the number of academic positions for training nurses in Manitoba, where we've initiated nurse practitioner training in Manitoba, where we've brought in more registered nursing training in Manitoba, including in French and English, Mr. Speaker. The specific skill set that the member has identified as being required in Manitoba needs to be linked to the fact that we're the only political party in this House that committed $24 million in the last election to training more healthcare professionals in the province of Manitoba, Mr. Speaker.
But this government has not got the job done. There's extraordinarily long wait times for those with communication disorders needs. Mr. Speaker, the Manitoba Centre for Health Policy study of social housing shows that 50% of Manitobans living in social housing are under 20 years of age, and that social housing is associated with very crowded living conditions, poor air quality from increased second-hand smoke, and social housing residents have much higher rates of respiratory disorders, including tuberculosis, and those who live elsewhere. I asked the Minister of Health, what is her immediate plan to improve the health environment for those who live in social housing?
Minister. There's been an approach to social housing that has never occurred in Manitoba before. When we rebuild social housing, we actually train people that live in the area with the skills to rebuild the housing. And it has made a tremendous difference in places like Gilbert Park and places like Lord Selkirk Park. We've moved early childhood development programs right into the housing projects themselves. We've built daycare centers in the housing projects themselves. We have congregate meal programs in the housing centers themselves, and our health clinics, Mount Carmel Clinic, Norwest Health Clinic, quick care clinics and nurse practitioners are all available to work directly with the people in the residential areas where they live, including the social housing projects. And I was very pleased last summer to be up at Gilbert Park, where we had an employment program where the young people were fixing up the neighborhood, cleaning up the neighborhood, providing skills in a labor co-op that helped everybody make that a better community. That's the kind of things we're doing in social housing projects.